Welcome to this seminar. I am an author and licensed marriage and family therapist working in the Los Angeles area. I also coach clients internationally by phone and Skype. The objective of this presentation is to help you identify and treat shame. I think you will be surprised to learn the extent to which shame underlies most symptoms and behavior of your clients. By being able to spot shame more quickly, you're able to focus on the core problem and more readily facilitate lasting change with your clients. Hazelden released my recent book, Conquering Shame and Codependency. About one-third of the book contains self-healing exercises which you can incorporate into treating individuals and couples. From the moment a client contacts you, shame is present. You may not realize it or really think about it, but often a client will feel ashamed of reaching out for help. They might feel weak, or that they have to depend on someone else, or that they're sharing secrets that they're ashamed of. When they see you, they might feel exposed if they suddenly start to cry, if they're uncomfortable sharing feelings. And we all have had experiences where a client projects their own self-judgment onto us, believing that we're judging them. Sometimes a client might think that they're a burden or that they're boring. Even the imbalance of power that's part of the therapeutic relationship can feel shaming because we know more than they do. They may feel ignorant if they've never experienced therapy, and that might feel shaming to them, or that they feel small. Some people think that we can see through them, and so they feel exposed. As therapy progresses, clients may become discouraged about the progress in therapy and feel shame about that they're not recovering as quickly as they'd like. We can experience shame too, and sometimes we can project it on the client, or we can pick up the client's own shame in our countertransference experience. So if we haven't dealt with our own shame, we can become very susceptible to reacting to the countertransference that's really coming from the client. I wrote an article available on my website under seminars and also on my LinkedIn page. It goes into a lot of detail on countertransference. We can experience anxiety, that's shame anxiety, about not being enough, not being sufficiently trained, or having expertise around a client's particular problem. When a client is unresponsive, we might feel inadequate. Also, if a client is criticizing us, if we make mistakes, it can trigger our own feelings of shame. And also, when a client is feeling discouraged about progress, we might experience our own feelings of inadequacy. We might defend against feelings of shame by experiencing inflation or grandiosity. I remember when I was a new therapist, I wanted to see the most difficult clients. After I had a few, I changed my mind. In this diagram, you can see that not only does the client project their shame onto us, we can project our disowned shame onto them. We might find ourselves being critical of a client, complaining to a friend about a client, or judging, pushing, prodding a client that comes from our own feelings of inadequacy and our own prior experiences. The goal in therapy is not to eradicate shame. We can't. It's universal and it's inevitable. It's been called a sickness of the soul. It's been referred to as a failure of the self or inner torment. Our goal should be to integrate shame. The degree of shame will range from mild embarrassment to feelings of mortification, coming from the French word mourir, to die. So if you think of the expression, I could have died, there's a profound sense of mortification, of humiliation. And it can be triggered by any event, but the degree of shame and the intensity will vary based on an individual's past experience, their personality, the culture that they grew up in. Research has shown as people that grew up in collectivist cultures, for instance in Latin America and Asia, tend to experience shame more readily. It's more conscious. It's talked about. It's used to socialize in families and children. In the West, even though there's just as much shame, it's more hidden because there's a bigger emphasis on guilt. The idea of losing face or saving face relates to shame because we want to hide who we are. That's the predominant feeling. It's a profound feeling of alienation, not only from others, but from the healthy parts of ourselves. Men, in general, will react to shame by more readily attacking others, and women will more readily attack themselves. Of course, this is a generalization. People do both. But there's gender differences in the triggers as well. So men are more susceptible to shame around topics such as strength or courage, if they feel weak, if they feel cowardly or fearful, if they're not a good provider, if their sexual prowess is waning or challenged, if they have difficulty controlling their feelings, they may feel shame. Women, on the other hand, are more preoccupied with their body and their appearance. They're susceptible to shame on those issues, as well as being a good mother, being modest. And it's also been shown that women sometimes feel shame when they have expectations that are conflicting. They can't be a good enough mother and excel professionally, or a good daughter and a good wife. So when they have these competing demands, they have expectations that they should be able to do everything, and then they experience shame. Shame is a reaction of the sympathetic nervous system that affects the body, the mind, and the emotion. You might experience blushing, nausea, dizziness, perspiration, but generally there's a sense of freezing. And children, you will notice, will slump. But as adults, we're socialized not to do that, so a person might laugh or show a look of contempt, tighten their jaw, and our mind might feel numb, that we can't think clearly. It's a sense of paralysis. Sometimes we can't even speak. And then we have self-critical thoughts that keep escalating, and it leads to feeling alienated, painful emotions of unworthiness, of self-loathing, and feeling inferior and weak, wanting to hide. It can lead to rage and feelings projected outward, so attacking others and wanting to withdraw. It's similar to, but different than feeling shy, because that's really a fear of strangers. And humiliation, the focus is more on the other person. If you feel the humiliation is deserved, then it triggers your shame. But if you feel that you don't deserve to be treated that way, then it's pure humiliation. I believe that when people react with rage to humiliation, it's because they're experiencing a reaction to shame, because then they feel that they have to defend themselves. Guilt is different than shame. Guilt, I've learned in doing the research for my book, can lead to healthier self-esteem. Guilt is different because we think that we made a mistake, whereas with shame, the belief is, I'm the mistake. You feel irredeemable. So there's nothing you can do. And it's a global attribution about oneself versus feeling that your behavior was a mistake, something that you can correct, you can make amends, you can change your behavior. And with guilt, you're more focused on your impact on the other person, whereas with shame, it's very egocentric, and you focus more and more on yourself, and you withdraw from others. You're concerned only with what others think of you. You tend to feel powerless. Guilt is empowering because you can find redemption. It doesn't lead to antisocial behavior like shame does. Shame leads to aggression and pathology such as depression, anxiety, post-traumatic stress syndrome, as I said, addiction, codependency, whereas guilt that is not connected to shame, and often people have irrational guilt, and it's usually because there's shame intertwined with it, doesn't lead to psychological symptoms. Mother Teresa thought that the biggest disease is not leprosy, but the feeling of being unwanted. And that really comes from internalized shame, sometimes referred to as toxic shame. It's having these voices and images and beliefs that were formed years ago in the past, and they linger. And then it makes the person, as an adult, more susceptible to shame. And rather than just feeling an acute experience of shame, the shame feelings are magnified. They last longer. They go into a shame spiral, which I'll describe in a moment. They can last for weeks or months, and it causes shame anxiety. And this is usually the anxiety that addicts and codependents experience. It's really shame anxiety focused on making mistakes, what other people are going to think of them, being a failure, being rejected, looking foolish. All of these underlying beliefs stem from underlying internalized shame. And it can lead to loneliness and, as I said, depression. They always used to say that depression was anger turned inwards. Now they see that shame is usually the cause of depression, but that's really what shame is. It's anger towards the self. A person doesn't have to remember what happened in childhood. A lot of times people will think that they had a perfectly fine, happy childhood. But still, even what they think was loving parenting can lead to shame, which I'll go into in a moment. And a shame spiral is diagrammed here with a shaming event, and shame has been defined as interrupting pleasure or interest in something. Suddenly you get derailed, and it leads to the physical symptoms and numbing sensation. There's a loss of energy, and then the person begins to have negative thoughts and feelings, and pretty soon they react with attacking others or attacking themselves, or both, wanting to withdraw, and then they become ashamed of their shame. And the spiral downwards is they start replaying this shame victim story, that this always happens to me, or I always make a fool of myself, or no one will ever want me, or I always fail. And they go into this story that they tell themselves, which leads to greater depression, feelings of hopelessness, powerlessness, despair, and emptiness, which underlies internalized shame. Some of the beliefs that go along with internalized shame are I'm a failure, I don't matter, I'm a bad person, I'm a phony, I'm somehow flawed or defective. You hear people talk about they have to do more. They have to prove themselves. They're constantly pushing themselves. What they do is not enough. This is because they don't feel that they are enough, and that's a belief that stems from shame. Some people even believe they shouldn't have been born because of messages they received, that their mother tried to abort them or didn't want them, things like that. Underneath all of these beliefs is a core feeling of unlovability. Most of these beliefs are unconscious, so you help your clients by making them conscious so that they can really address them, see where they come from, often because of their childhood experiences. People don't usually know that they have a belief that they don't deserve happiness, but they are continually not happy, or they sabotage themselves. Shame hides who the real self is, the whole self. And a child develops that whole self and can realize that self as it matures when it develops in a nurturing, safe family marked by individual acceptance and authentic connection, and parents are responsive to the child's wants and feelings and needs, so the child learns to act and respond from their own internal cues rather than outside of themselves, which is what codependents do. Their behavior and thoughts revolve around something external, another person or a drug or a process addiction. And a person who is coming from the real self is able to assert their needs, their wants, their feelings. They intuitively have boundaries, and they lack the anxiety and inner conflict that people that have internalized shame experience. They just know what they want, and they feel comfortable asserting that. The reverse of that is emotional abandonment, where the child doesn't experience accurate empathy. And this is a need that we all have in order to validate our separate psychological existence. And this is the basis of creating a separate psychological self, enabling us to individuate from our families. A child gets that when it feels uniquely wanted by both parents. It's not enough that one parent respects and loves them. They must feel that each parent wants a relationship with them for who they are, not for what they do or achieve or perform or conform to their parents' wishes, but for who they are innately. And that is conveyed through this process of accurate empathy, where the parent matches the child's needs and feelings and wants, and that validates that child's individual psychological existence. And that's a basic human need. Otherwise, a child feels alone and has this deep insecurity. Karen Horney referred to it as a basic anxiety. A child will feel lonely when they're not getting their feelings and needs matched. They don't feel that they're understood, that their parents get them or love them. They feel alone. They might feel invisible in the family, or like they don't fit in, or their family doesn't understand them, or an outsider in their family. That's sometimes referred to as the trauma of invisibility. And this loneliness and emptiness gets filled with negativity. Parents that are indifferent or manipulative, interfering, or inconsistent cause a child to feel hostile. It's just a natural reaction. And often that hostility is turned against themselves. They feel bad, they feel unimportant, they feel unworthy of love. And this is all how internalized shame gets constellated. Obviously, abusive parenting is shaming. Any type of abuse violates a child's boundaries and is disrespectful, is not honoring that child. And that in itself is shaming. And often, sibling abuse is overlooked. I've seen many clients where we talk about the parents. They were pretty good parents, but they didn't protect their child from sibling abuse that sometimes is very malicious and can leave scars and feelings of shame. A sibling that ridiculed them, teased them, belittled them. Parents that are being helpful with criticism. Parents that blame. Parents that rage. Neglect also leads to shame because the child doesn't feel that they're important. A parent that's authoritarian and domineering or controlling, exercising power over the children so that they feel inferior, that they don't have a voice, that their wants and needs and feelings don't matter, also leads to feelings of shame. And of course, in drug-addicted families, there's underlying shame. But even well-meaning parents that are just overstressed, particularly nowadays, there's often a single parent that's working and taking care of the children. The parent may just be irritable or stressed and indifferent to a child's needs. Or parents that are trying to be better than their parents were and to compensate, and so they pressure their children to do more. Or they're overly involved, limiting a child's feelings of autonomy. They're overprotective. They undermine a child's trust. If they overcorrect, the child is filled with self-doubt, despite how well-meaning a parent can be. Parents that make global attributions about a child, saying how special they are, how wonderful they are, teach a child to make global attributions about themselves. And children naturally have black and white thinking, so they'll tend to think that they're all good or all bad, or they're either perfect or imperfect. And parents that boast about themselves, compare their child to another sibling, even to their own selves growing up, or to a neighbor, teaches children to compare. Implied is the child is coming up short. It's also been shown that too much praise or alternating praise and criticism can make a child feel insecure and inferior. There can be secrets like infidelity, criminology, mental illness. When there's family secrets, the shame is unspoken, but it gets transferred onto the children. You've probably heard of shame bonds. Anything can be linked to a shame bond. Usually their feelings or needs. It could be something about a child's appearance or an interest they have, their interest in sports, for instance, or their posture. When something gets bonded to shame as an adult, when that person feels the feeling that's been shamed or experiences a need that's been shamed, they start to feel shame about it. often it gets internalized from childhood, so they're not even aware that they feel shame, and they just go into denial so they don't feel that feeling. The feelings go underground, or they don't experience that need. If they're punished for having that feeling or need or a certain posture, for instance, then fear can get attached to the shame bond. So, for instance, if a child is told that they shouldn't feel sad or they shouldn't be angry, that's shaming in itself. But if they're punished for it, then, for instance, with anger, they have a anger-fear shame bond. So this anger and fear is attached to it. And then they might feel afraid as an adult of expressing their anger. So you see this in this picture, this child is afraid of being punished for whatever they did, and maybe their behavior was shamed, and now fear is attached to it too. Children cope with this feeling of emotional abandonment in childhood by creating an ideal self. And this is so that they can hide who they really are because they feel ashamed of it, it's not good enough, and they create this ideal imaginary identity that enables them to feel accepted and loved. And it also gives them an imagined sense of worth, of power, of superiority. They continually try to become their ideal self because they think that's who they have to be to survive and be accepted in the family. And they get further and further away from their true self. Here's a diagram of the developing self, and that real self is hidden. It's surrounded by the devalued self, is what they experience when they think of themselves because of the critic, that internalized shaming voice. The person they show to the world might be their codependent self, who they try to be, the false self, instead of their true self. And then the fuzzy exterior self is the ideal self. It's never fully realized, but they're constantly striving to achieve that. Some people will develop a whole personality around this ideal self that helps them protect who they really are instead of being authentic and vulnerable. I refer to masters who move against people with aggression, and they've idealized perfectionism and need for achievement, a need to exploit others, a need to be admired. Your stereotypical narcissist would fall into this category. And then you have people that often get into relationships with someone like that as an accommodator because they move toward people. They've idealized love, and they want approval. They need affection, and they have a more restricted life, and their main behavior is compliance when it comes to other people. And these are just constructs to help you think about and talk about them, because most people are combinations of these three types of people that I'm describing, these three personalities. There's bystanders that move away from people. They're more detached. They don't want to get involved, and they restrict their life. They don't want to get too close to anyone. They idealize self-sufficiency. This diagram shows how the devalued self grows in lockstep as the gap between the real self and the ideal self widens. Because the more a person strives to be their ideal self, the further and further they get away from their real self. And this causes feelings of alienation from themselves and others, anxiety, and unhappiness. I mentioned the critic. You might refer to the critic as the interjected parent or a superego. I also said it can be anger towards the parent that's internalized, and is characterized by contempt for the self, and it can get projected outward, and a person feels superior and contempt for others. It works hand in hand with the pusher and the perfectionist. Perfection is a symptom of codependency and is a compensation for shame. The perfectionist sets up these ideals based on the ideal self. The pusher pushes the individual to achieve them, and the critic will criticize the person because they are always falling short of their ideal self. And with internalized shame, an individual is hypersensitive to criticism and rejection, whether or not it's real. They perceive criticism often when it's not even happening in reality. They imagine they're being rejected or criticized when they're not. So in trying to be our ideal, we are trying to be who we're not. Karen Horney coined the term the tyranny of the shoulds. This diagram shows how shame can manifest in two ways. A person feel superior to others, and they project outward their shame and devalue others. And underneath that is their devalued self that feels inferior, that might be unconscious. Or a person may be just conscious of feeling inferior, and they idealize others. And some people flip from one position to another. Some people are stuck in one role. For instance, a narcissist may feel arrogant and superior most all the time, and someone who has very low self-esteem may always feel inferior. But most people fluctuate between these two positions. And I show you that chart so you can see when someone is devaluing or someone is idealizing, that's a clue that there's shame underneath and can help you to get to what's really going on. Projection is a defense to shame. So is arrogance. So is perfectionism, as I've mentioned. Humor can also be a defense. It's considered a more integrated or mature defense because it's helpful socially. You'll see sometimes TV personalities or a broadcaster that makes a mistake and they make a joke about it, and that's an adaptive way to cope with their embarrassment and their shame. But typically people will withdraw, as I said before, they attack. People that are into retaliation are usually trying to compensate for the shame that they have felt. Self-pity, I also think, is a defense to shame because the person thinks that it's all happening out there, that it's external, and they feel a victim. They feel, instead of that their shame is coming from within, that it's being done to them. And self-pity usually involves anger. It's different from empathy for oneself. People avoid shame through addiction and distraction. And most of the codependent main symptoms are manifestations of shame. So impaired self-esteem goes along with codependency, and people-pleasing is part and parcel of that, trying to please others, and these are symptoms of underlying shame, as well as the core feelings of codependence, which are anxiety, fear, anger, guilt. They have a lot of insecurity. They lack self-trust. They have trouble making decisions. One of the reasons that they're indecisive is because they have a very strong critic that will criticize them if they do X or if they do Y. So they can't make up their mind because they feel that they're damned if they do or if they don't. And that leads to a lot of indecisiveness, along with their self-doubt and lack of confidence, all coming from shame. Dysfunctional communication is a symptom of codependency. Being not assertive, I'll talk about that more momentarily. But that stems from shame because shame makes us want to hide who we are. We deny our feelings and needs and wants because they've been shamed. So then we can't be assertive about them. Shame and insecurity makes us want to control others because we need them to behave a certain way. We need them to like us. So we have to control them to ensure that we're okay rather than dealing with our own internal feelings of self-loathing, insecurity, shame, emptiness. Caretaking is also a way that we can cope with shame because we can feel superior. We can feel good by taking care of someone who's more needy than we are, giving advice. Usually the caretaker is not sharing themselves. They don't have to be vulnerable. And the person that's dependent on them won't leave them, so it protects them from being abandoned. And then depression is a symptom of shame, as I mentioned. And all these lead to problems with intimacy because of underlying shame. Other clues might be defensiveness or hypersensitivity to criticism. I had a client that thought he had very good self-esteem, but wondered why he was defensive. And he didn't think that he was self-critical until we started exploring his defensiveness, and he realized that he had these perfectionist ideals and that he was hypersensitive because he was very self-critical, and that made him defensive. People procrastinate because they don't want to make a mistake or because of their insecurity. being a victim, and on the other hand, being an abuser, where the person is projecting out their shame. They're shaming someone else or being abusive to them as they have been treated because of their own shame. And that's the way that they can disown their shame, by abusing someone else. Comparing yourself to others, usually coming up short in comparison. Envy was on my list of defenses. It's another way of comparing oneself to others and feeling less than. And I mentioned idealization and retaliation. And often addicts will do self-destructive behavior that makes them feel more ashamed. This is a way of avowing shame. It makes their unconscious shame conscious, because now they've really gone on a drinking binge or they've been highly promiscuous, and then they feel ashamed. But it's really the shame that's driving the behavior to begin with that they're not aware of. I mentioned impaired self-esteem, and I prefer to use that term than low self-esteem because, for example, narcissists may be considered to have good or high self-esteem because they think highly of themselves. Self-esteem is a cognitive evaluation, but because it's not based in reality, it's inflated, it's impaired, and there's really deep shame underneath that self-inflation or denial about certain things about themselves. Some of the thoughts that go along with impaired self-esteem is, I don't trust myself, I don't know what to do, people don't like me, I don't like attention, I don't know what I want, feeling that my needs or thoughts aren't important, my feelings don't matter, that I can't do that. And fear and anxiety goes along with shame, as I mentioned, and it's called shame anxiety, and that's the fear of experiencing shame in the future. Anxiety is anticipatory fear. Codependents and addicts have a lot of anxiety. It's often shame anxiety. The fear is, what if I'm judged? What if I'm not liked? Or what if I get rejected and I'm abandoned? If I'm alone? What if I fail? Or what if I get hurt? Often these are not conscious. Instead, behaviors are used to cope with these fears. So as I said, controlling someone so they're not abandoned, trying to be perfect or constantly achieve so that they will be liked, clinging to someone or controlling someone so they're not alone, being afraid to start something new so they don't fail. They only do things that they know that they can succeed at. In my chapter on relationships, I refer to shame as love's silent killer because it really not only destroys relationships, but it destroys love. Because real love and intimacy is based on connection and authenticity. And that's just the reverse of shame that leads to alienation. So when you have a lot of shame, it's hard to be authentic. Here are some of the obstacles to intimacy caused by shame. Feeling unworthy of love and happiness. So if you don't feel worthy of love and happiness, you're not going to experience it. You're going to deflect it. You'll be with someone who doesn't love you. Think of how people deflect compliments that they don't feel deserving of. Well, the same thing applies to love and relationships. If they don't feel worthy of love, they'll be with someone who's emotionally unavailable or who abuses them. And as I said, non-assertive communication. People will project their critic onto others and think that they're being criticized. I've worked with couples where one spouse is complimenting the other, let's say the wife, for example, and she hears a criticism. And I ask the husband to repeat it 2 times, and she still heard a criticism. So because of her internal shame, she blocked out anything that was dissonant with her own self-image. And as I mentioned, shame causes a fear of vulnerability and authenticity. I always say that intimacy requires courage twice. First, the courage to be honest with ourselves, and then second, to be honest and authentic with someone else. because if we have internalized shame, we're afraid of being judged and rejected because we don't feel worthy. If someone really knew me, or knew how I felt, they wouldn't love me, they wouldn't stick around. And then the shame-bonded feelings and needs are denied, and so a person can't ask for what they want. They expect their partner to read their mind. They might not even know what they want. They might put up with unacceptable behavior because they don't even realize that their needs aren't being met. They can't communicate their feelings if they've denied them. Of course, I should point out that people are on all different levels of the spectrum of codependency. So some people are very much in denial of their needs and feelings. Other people are aware, but they don't feel entitled to get them, or they feel too anxious and afraid to express them. People are in varying levels of individuation. Another way that shame prevents intimacy is that couples frequently will feel responsible for each other's actions and feelings, and then they get defensive. They feel guilty for their partner's behavior. Or a partner is expressing sadness or anger, and right away they say, well, I didn't do anything, and they take it personally. They're highly reactive because they're feeling responsible for someone else's feelings and actions because of their own shame and guilt and lack of boundaries. People use defenses to shame that they learned in their family. So how they saw their parents interact and cope with shame, they will use those same defenses in their relationships. And those defenses I mentioned of attacking, projecting, withdrawing, all cause more shame. So you attack someone, they defend, they attack back, or they withdraw, and a person feels abandoned, and you get these escalating cycles of conflict. So as I said, couples will misperceive one another and maybe feel judged or judge one another when they project their own critic. Sometimes they withdraw or they freeze when they're under attack, and that creates shame in their partner. One couple I saw, the husband was verbally abusive to his wife, and she would freeze like a porcupine, and he would escalate. And the more she got quiet, the more he escalated. What was underneath his behavior is that when she quieted down in order to protect herself, he experienced that as shaming. These escalating patterns of projection, blame, defense, attack, withdrawal, couples do this all the time, leads to high reactivity, high conflict couples. And underneath it's usually shame. And if you can interrupt these cycles and help them to get in touch with their own shame, and if they can then share it with one another, then they can build emotional bridges of empathy and connection. Now, I mentioned dysfunctional communication. When a person is alienated from their true self, they can't communicate. They can't be authentic. So again, as I said, they deny their needs, their feelings. They can't communicate that. They might have shame anxiety about rupturing the relationship if they really were honest, or that their partner will criticize them or retaliate. Oftentimes people say they don't want to be a burden. They don't want to ask for their needs. They don't want to be an imposition. Or they're afraid of looking foolish if they think that they always have to be strong and they can't ask for their needs or what they want. People usually say, well, I don't want to tell my partner my negative feelings because I don't want to hurt their feelings. But really what's underneath that is they don't want to experience withdrawal or anger from their partner. They don't want anything to rupture the relationship. They don't want to make waves. And so their true feelings go underground. They act romantic, but they're not authentic with each other. Firestone, the psychologist, refers to it as a fantasy bond. And pretty soon the relationship gets very dull and dead because they're not open and honest like they were when they first met each other, maybe, when they were less at risk. They might also feel ashamed of appearing weak when they are vulnerable, looking inferior. So these all prevent them from being authentic. When a person doesn't feel entitled to love, what happens is they're with someone unavailable, and then there's this pursuer-distancer dynamic that gets set up. And they're constantly looking for love by someone who's running away from them. The distancer keeps running, but never quite gets away, and the pursuer keeps chasing, but never catches her partner or his partner. So they never really get connected because underneath their feelings of shame and emptiness, they don't feel entitled to love and worthy of love. The cycle of abandonment starts in childhood and leads to shame and insecurity, fears of intimacy. They get into abandoning relationships. They feel more shame and insecurity and fear of intimacy, and the cycle keeps repeating in a downward spiral. So in working with shame, the first step is making it conscious, because of course we can't heal what we're unaware of what's driving our behavior. So you want to help clients by pointing out their motivations and the shame that's underneath their behavior, their feelings, when they're using shame defenses, when you hear them shooting on themselves, they're self-shaming. Help them identify shaming patterns in their childhood by their partners, by their family members and friends. Often clients will come to a session in a negative mood. 9 times out of 10, it's often because something happened that triggered shame, and they ended up in a shame spiral. After a day or two, they're in the dumps feeling empty and depressed. You can track it back to the original shaming event and then see where that leads you, maybe to some of their beliefs or events in their childhood. So you want to help them identify traumatic events that were shaming in their past and their shame-based beliefs. Some of them I've pointed out, but they're going to be different for each person. And it can be also helpful for them to write out what they think their ideal self would be, because these are the expectations they impose on themselves. And the more that they can become familiar with their internal critic, the more helpful it will be, because usually people are very identified with that voice, but the more aware they are, and I tell people to write down their self-criticism on a daily basis, the more that they disidentify with that critic. I will interview their critic, or they can do it on paper to find out what the critic really thinks of them, find out the critic's motive, intent. I have an ebook called 10 Steps to Self-Esteem, which lays out 10 steps that they can do over 10 weeks or less to really working with their inner critic. I call it the ultimate guide to stop self-criticism. So when they start to see that the critic puts them in double binds, and you look for paradoxes, then they realize that the critic is going to criticize them no matter what. And then they can start not taking the voice so seriously. And you can use CBT to challenge some of the critic's beliefs and things that the critic says to them. Find out where did that come from, challenge those beliefs, and what are the critic's goals. And usually there's better ways of meeting those goals than criticism, because oftentimes the critic really wants to protect the person. Like, I'll lower your expectations so you don't get hurt, or I'll criticize you so you'll do better on your job. I'm going to criticize you to improve you. But it's really counterproductive, and there's better strategies for achieving the critic's goals. I would also interview the pusher and the perfectionist, because the perfectionist sets up these ideals, the pusher will push the individual, and then the critic will come in and find fault. And you might want to hear from the devalued self that's listening to all this negativity and self-criticism, and that ends up feeling inferior and depressed. In the book, I go into ways to interrupt shame spirals. One way is to help your client recognize a shame attack when they're having it, to identify their triggers and their shame story from childhood and do a reality check. This is really what's going on. It's usually something from their past, the same story that they play over and over, and helping them to focus their attention outside of themselves because shame is so internalizing. I practice that in my office with clients. Ideally, they'll experience shame right there in the office with you, and then you can work with them. It's important to help them build body awareness so they can actually feel at a sensory level what's going on and to develop empathy for themselves. Sometimes just doing focusing, the feeling will just disintegrate or even transform into feelings of contentment. So that often happens if they can stay with their pain rather than reacting to it. Helping them to work with trauma from the past, that's beyond this talk, but I use EFT. If you're trained in sensory experiencing or EMDR, those are useful. CBT has also been proven to be effective with trauma. Hypnosis. You want to try to introduce corrective imagery, sometimes even injecting yourself into that prior experience, or an advocate or their adult self to stand up for themselves, to protect them. And you want to help them identify beliefs that were formed about themselves during a traumatic event so that they can separate out the truth or the shame that was being projected or transferred by a perpetrator or parent from the reality of who they are. That, I think, is a very key element in healing from trauma. And then introducing alternative positive beliefs. And finally, you want to teach them how to love themselves and nurture themselves. It's not enough to just work with their thoughts and feelings, but they have to learn to comfort themselves. And most people that come from codependent families or families with addiction, dysfunctional families, haven't learned how to nurture themselves, teaching them to use positive self-talk. Our unconscious doesn't distinguish between praise and encouragement that comes from someone else or from our own voice. It has the same impact on the nervous system and the brain, and helping them to practice self-forgiveness. I have a blog on my website called 18 Tips for Self-Forgiveness and Overcoming Guilt. Download that if you like, or refer clients to that. There are 18 strategies and exercises that they can employ. Doing esteemable acts, doing things that are consistent with their values, taking risks that are reasonable, and that includes setting boundaries. Setting boundaries and being assertive is key in developing self-esteem. In fact, your self-esteem is revealed by your communication. I agree with Virginia Satir on this. And so if you're assertive, it is a symptom of healthy self-esteem. And assertiveness or non-assertiveness is learned in families, and it can be learned as an adult. I wrote an ebook called How to Speak Your Mind, Become Assertive and Set Limits. This is an easy way for clients to become more empowered and to raise their self-esteem. Keeping commitments to themselves. In the back of Codependency for Dummies is 10 ways to love yourself and 10 daily reminders. I also have a blog on 10 tips to self-compassion. Another thing clients need to do is to learn to honor their feelings, to have empathy for themselves. So many have shame-bonded feelings that they negate their feelings, they judge their feelings. I have a YouTube up called Recovery Exercises for Self-Love, Self-Confidence, and Relaxation. And there's some visualizations that clients have told me are very helpful for them to practice. They need to learn self-soothing techniques, which you probably teach to your clients, like breathing exercises. I do a lot of work with the inner child, either through visualization or Gestalt work or pen and paper dialoguing with their inner child. it's very important that they're able to identify their needs. Typically, codependents are attuned to the needs of others, but are unaware of their own needs and how to meet their needs. So that's an important part of building self-esteem and learning to nurture themselves, along with being able to enjoy healthy pleasures and play. Sharing minimizes shame. That's one of the benefits of 12-step groups. It can reduce shame because people reveal themselves and they see that other people feel the same way. So they don't feel like so alienated from others. They don't feel so inferior. Gee, other people have these same human emotions. So what is the goal of recovery and wholeness? I think it's someone who accurately perceives themselves and others in present time, that they're individuated, that they're not reacting to the beliefs and the trauma of their past, that they're able to be authentic, so their expressions are congruent, their feelings, their needs, what they say, what they do is consistent, and they have autonomy, so they're not threatened by separateness, and they're also capable of intimacy. In fact, intimacy can't exist without autonomy. Otherwise, you just have people that are merged instead of two separate selves. So it's important that they can hear others separate from themselves. So when you think about it, if there's too much shame, not only are they afraid to reveal themselves, but they're going to be very reactive to someone else, take everything personally, and they can't see the other person as separate. That leads to all sorts of problems in relationship and intimacy. And finally, that they're able to be flexible and not have rigid thinking and rigid behavior. Rigidity is often to protect an insecure self, someone who is very rigid in their thinking and their beliefs and their behavior. Shows how fragile they are. So I invite you all to go to my website to get a free report called 14 Tips to Letting Go. On my website, whatiscodependency.com, on the seminars page, there are other talks that you can listen to. There's also links to my YouTube channel where there's audio and also video of other seminars. You can follow me on Twitter, and you can find me on Facebook. My Facebook page is Codependency Recovery. I also have a timeline. My name, Darlene Lancer. And my books are available on Amazon and in stores. Conquering Shame and Codependency goes into great detail about the types and etiology of shame, how it influences relationships and codependent symptoms and sexuality. I devote an entire chapter to emptiness that underlies codependency and addiction, and I make suggestions for working with it. The largest chapter focuses on the way shame derails relationships and love. About 1/3 of the book contains self-healing exercises which you can incorporate in treating individuals and couples. My ebooks, I have 4 of them. How to Speak Your Mind, Become Assertive and Set Limits, is also available on Barnes & Noble and Amazon and on Smashwords. There's links to all of them on my website. Under my books on my website, you can hear what others have said about the books if you want more information. 10 Steps to Self-Esteem is available, and Codependency Daily Reflections is a daily reader, and there's links to articles and tips and some exercises and insights on raising self-esteem and healing codependency. My newest ebook, Spiritual Transformation in the 12 Steps, is a guide to working the 12 steps. It tells the history of the 12 steps, and it's a psychological and Jungian interpretation of them. It's very deep, actually, and it talks about how an individual transforms through working the steps. It's written so that someone who is agnostic or atheist can relate to the way of working the steps as it's presented. So I want to thank you all for joining me, and just to remind you that this material is copyrighted, so please do not distribute or copy the material.